Yes, there we
Wow.
are.
Thank you.
Amazing.
That was hard work.
Wow. That was difficult. Right. Okay. Here we are. So I'm here
Yeah.
with Edward Ball,
It's going to be
hair
worth it, though, isn't it?
transplant surgeon extraordinaire. It's definitely going to be worth it. We already have some questions
It's going to be.
over on
Okay.
YouTube. So the first question is, how did you get into becoming a hair transplant surgeon?
So, well, anyone can come from all sorts of backgrounds. My background, I think if I had to write a background for a hair transplant surgeon, I'd be pretty close to what I did, because I think, well, my background was I was a general practitioner and I was a plastic surgery trainee for 2 years in the NHS, and I did dermatology surgery for 7 or 8 years at Southampton Hospital, doing skin cancer, facial surgery, and minor lumps and bumps. So that to me brought a lot of skills and techniques towards a specialty that requires understanding the health of a patient, understanding skin, aesthetics, having a good steady hand. So that's my background, but in reality, people can come from any background into hair transplant surgery.
Medical, though, just to be clear.
No, it's a good point. We do get people asking that. Sometimes they'll ask me at the end of a surgery, but by the way, do you have to be a doctor? I'm thinking, gosh, that really should have been a question earlier in the session. But yeah, you do need to be a doctor, and it's a really important point, because there's a big problem at the moment with the industry ballooning, which is great because it offers more choice for patients, but it's a real challenge because clinics are popping up left, right, and centre, and patients don't realise often that they're being treated by someone who isn't medical, and various aspects of the surgery that's being performed, which should definitely be carried out by a doctor, so cutting the skin, giving anaesthetic, designing a hairline, planning the careful use of your lifetime donor supply, which is limited, and therefore you need to be really careful about how you plan someone's long lifetime journey. Those aspects must be done by a doctor, and there are clinics, sadly, where patients don't realise that they're being treated by non-medical professionals, and so it's a lot of that is overseas, and it's something I was hoping we might chat about, because I think one thing to really get across is to try and help patients to stay safe in an industry that is loosely regulated.
Well, let's talk about that, since we're talking about it already. So is that a thing then? People are passing themselves off as doctors in hair transplant surgery and then they're not? Or
well, it's not so much they're passing themselves off as doctors, it's just the question often won't be asked, and some clinics are fronted by a salesperson, and there's no mention of who the doctor is going to be, and they won't be able to tell you who the doctor is going to be until the day of surgery, and that should ring alarm bells for patients. So I think there are a list of questions that we like to share with patients, and you can find it just by Googling online, but there are certain things the patient should know to ask, and that is, who will be doing my surgery? I need to meet the person who's doing my surgery at the soonest opportunity, well in advance of the surgery date. You need to be able to see exactly what work that person has done. You need to see really detailed photographs of their previous patients, not just a slightly out of focus before and after shot from one angle. I mean, anyone can fake a result. You need to have really detailed shots from various angles. Even better, ideally, YouTube video diaries from patients who've been through the whole journey. And it's a brilliant way to share someone's experience and to see real time exactly the changes that happen over the 6 to 12 months it takes for hair transplant to come to fruition. So these are the things you need to pin down the clinic and the doctor as to exactly what will be happening when your procedure takes place. The challenge is people go overseas, they go to somewhere where it's not so well regulated, and maybe there may be 10 surgeries going on in a day in that particular venue, and there's no way that you can assure quality with so many non-medical staff when there's such a turnover. And that's of course how they manage to offer quite cheap surgery, but it just means that people need to be really careful when they're making those decisions.
But the people who work with you then, your assistants though, maybe you could tell us a bit about their background as well.
Yeah, so it's an unusual specialty, because whereas when I was working in plastic surgery, it's you and your scalpel, and you are the person that determines the outcome of your work. With hair transplant surgery, there are other variables, and again, that's why people need to be careful. So I chose to set up a very small clinic where we just treat one patient a day with a very small team who work full time for me. So I've controlled the variables that I can, but there is a temptation, I think, for clinics to get rather large, and therefore the doctor cannot do everything, and you certainly can't be treating two patients at once. So the way that sometimes happens is that there will be non-medical people performing parts of a procedure that they shouldn't be. My particular staff, I have 4 hair transplant technicians who don't have to come from a medical background. They need to have amazing manual dexterity and incredible attention to detail and the ability to do one focused task for hours on end. And they are incredible. I get people complimenting them every day about how they're just hard at it until it might be 9 o'clock, 10 o'clock at night. It doesn't matter. Just a procedure can take as long as it takes, and sometimes we're there till into the evening. But so there's a pretty specific set of skills for these guys, and therefore you can understand they're quite hard to come by, and certainly good ones are hard to come by. So the surgeon will be doing what's most important in the surgical aspect, which is the planning of the hairline, the giving of the anaesthetic, the assessment, the medical assessment of the patient, the diagnosis. People often just assume they've got male pattern hair loss. There are countless causes for hair loss that shouldn't necessarily go on to have a hair transplant. So that diagnosis stage is crucial. And then the hair technicians come in to usually assist the surgeon, as in many forms of surgery, you'll have an assistant in surgery. They'll also often help by placing the hairs into the incisions. So I'm sure we'll talk through the steps of a hair transplant, but towards the end of the procedure, they're putting the hair into the little incisions that the surgeon has laid out, which is the design. And that is often done by the hair technicians because it's something they do repetitively day in, day out, and they're just brilliant at it.
Well, actually, why don't we talk about that now then? So the process for actually having a hair transplant, how does it work?
So there are 2 main techniques for hair surgery. They are very similar. The difference in the 2 techniques is how you get the hair. So a hair transplant works on the principle that the hair we have on the sides and the back of our heads is programmed genetically to continue growing for the rest of our lives, pretty much. There may be some subtle thinning as we age, just globally, but that's the basis, and it's known as donor dominance. The donor hair around the back and sides of your head retains the characteristics from where it came, even if you put it somewhere where you're losing hair. So that's the basic fundamentals of how a hair transplant is able to work, because people will often say, well, how can you take hair and put it in an area where it's thinning? Surely those hairs will thin, but they don't, because they retain that characteristic, which is that it is not susceptible to the hormone, which is what's causing the hair loss. Specifically in male pattern hair loss, it's a DHT, dihydrotestosterone. That hormone attacks the hair, as it were.
So the main principle being that the hair on the back and sides is going to continue growing regardless of where you move it to. And the 2 main techniques for taking the hair are FUE, which is the more modern, not necessarily superior, but it is the more recently developed technique, FUE, follicular unit excision, where we take individual hairs from the scalp, leaving little dot scars where they're taken from. And that's an important point, because some people will try and suggest that it's scarless surgery, but you can't cut the skin without leaving a scar of sorts. They are tiny dot scars, and the point is you leave these little dots which generally allow the patient to wear the hair at any length, whereas the other technique, rather than taking the hair individually from the scalp, is to take a piece of skin from the scalp. So it's known as FUT, or strip surgery, which has been around for a lot longer. So we take a strip of skin that is then given to my technicians, who we were describing earlier, and they will be sitting at microscopes and dividing that piece of skin into little slivers of skin. And then another technician takes those slivers and divides them into individual follicular units. And that's the end point from both techniques. Both techniques end up with a graft, which is a follicular unit, and that graft may contain 1 hair, may have 2 hairs, 3 hairs, even 4 hairs, and that's how they naturally occur in the scalp. And so that's how we then naturally transfer them to the recipient area. And that's the biggest breakthrough, really, that has allowed us to offer such natural results, because some people will have heard of the old plug surgeries, which were done years ago, in the 1990s and before. And that's where large pieces of skin were taken from the back of the scalp, and they contained multiple follicular units, and that therefore didn't look natural because it grew in little clumps and left big scars at the back of the head. Now we take individual follicular units, and we're able to then hunt out the very finest little single hairs to create a soft hair hairline, and then slightly thicker single hairs behind that, and 2 and 3 multiple hair follicular units. And the way we lay out the hair is how we can cleverly create the illusion, because it is a bit of an illusion, of density that would appear to be more than the number of hairs we've actually used. And by the way, are we audible on YouTube now?
I am just trying to find out actually if there's any sound. Any sound there?
It hasn't got to the point.
Oh,
yet,
it hasn't got to the point yet. There's a slight lag on YouTube. So I'll let you know. You've got some questions here already. Can you see? On Instagram.
Yeah. They appear and then they disappear.
So one of them was...
Are you going to put them to me?
Is it important to use microscopes when having FUE? And is it correct that in order for the hairline to be completely natural, the hairline must have single hair grafts?
Right, absolutely. So that's one of the questions that I referred to earlier. There are a number of questions that it's worth asking a clinic when you're working out where you want to go. And whether or not a clinic uses microscopes is absolutely crucial. It's sometimes a step that's skipped because it requires some skill. It adds a time delay to the procedure. So if someone's trying to get through lots of surgery in a day, maybe they may skip that aspect. But it's really important that when the grafts are extracted, so I extract the grafts, they're then put into a chilled storage solution, which is the same sort of solution that one might use to put an organ in. So it keeps the graft really healthy when it's out of the body. That then goes to the technician who's sitting at a microscope, and they will then examine it in great detail to assess exactly how many hairs there are in the graft, and then also to grade those grafts. So as you mentioned, you want very fine single hairs in the hairline. It's no good just having single hairs in the hairline. I mean, that's a help, but you need to grade it. You need little soft fine hairs in the front and slightly coarser hairs behind that, and you build up the density. And that's what gives you that look of a hairline that looks as though it was always there, and it will not raise someone's eyes to your hairline. And patients come to me saying they've had bad hair transplant. They hate the fact they see people's eyes flick up at their hairline, and they want me to somehow soften it and make it look more age appropriate. And that's what we do when we're using those single hairs so importantly.
That's really interesting, actually. Sabzi has been very diligently asking hair transplant questions throughout the week in preparation for you coming on, and has asked, can you do a hair transplant on a woman, and does the head need to be shaved beforehand?
Okay, so they're good points, because yes, definitely we can and do hair transplants on women. Women make up about 10% of my patients. They are incredibly satisfying patients to treat, because it is genuinely life-changing. And the emails you get back and the photos, how a hair transplant has changed their life. I mean, obviously, it makes these changes for men and women, but I think most people would agree that it is more socially acceptable to lose hair if you're a man. And for women who are losing hair, it can be, it destroys confidence. And the main treatment that we offer for women is actually hairline transplants. There are lots of different reasons for losing hair, and in whether you're a man or a woman, the important thing is to have stabilized the hair loss as much as you can before you do a hair transplant, because otherwise you're putting hair into an area while the rest of the hair continues to thin, and you're going to end up with a little improvement and then a deterioration again in coming years. So it's really, really important to try and stop the hair loss, and there are lots of medication and treatments that we can use to achieve that. Even better, you can thicken the existing hair there with medication before a transplant, and you can get this double impact of a transplant and thickening the existing hairs, and it looks incredible. But importantly, it sets the patient up then for the rest of their life, because so often treatments are offered to patients with a hair transplant just for that short-term gain, and it may look okay for a year or two, and then it will look awful if they continue to lose hair and they don't have enough donor hair to continue to replace the hair that they're losing, or if the hairline is put in a silly position and it just looks odd because they're aging, and they come to me saying, I went so and so and I wish I hadn't had this hairline so low, I now look odd, I'm in my 50s and I shouldn't have a hairline here, I want it higher and softer and more receded, or they have a bald patch that's appeared, and of course it looks odd having a very low hairline and a bald patch. So it's not essential to shave the head, but the two techniques I mentioned earlier, being the FUE, normally we do have to shave the head for FUE, it is possible to do smaller procedures without shaving the head, or to just shave small areas that can be hidden, but there are downsides to that. So for the perfect procedure, FUE, we would usually shave the donor area. We can leave the top long if necessary. Ideally, we have access to everything. But for that reason, we don't tend to use FUE very often for women. For women, I nearly always use the FUT, which leaves a line scar at the back of the head. And the response I get from people is that they don't know where it is. It's as if it was never there, because it's so easy to hide within their hair. They can wear it up, down, whatever they want, and the scar will be very hidden. The only catch is that we all heal differently, and so you can never be assured of exactly how your scar will look. And we get really nice scars because we're very careful, but I can't tell someone exactly that they will have this fine little pencil line scar, because it depends on their own skin type as to how they heal. So that's part of what we use to weigh up the decision when you're choosing the two techniques. But if you go down the strict FUT technique, if we were restoring a hairline, say in a woman who has recession in the frontotemporal angles, or they've maybe lost hair because of traction, wearing the hair too tight back, or they've just been born with a very high congenital hairline, that is brilliantly suited by the FUT technique, with the line scar hidden within their donor hair, and there's no need for them to shave their hair.
Does it feel tight?
Often people will say it feels tight at the end of the day, but it's not physically tight. In order to give you the best chance of a nice fine scar, I like to bring the skin together really effortlessly, and you need to just respect what the donor will allow you to do. And if you only take the loose skin, it does feel a little tight, but it goes within days. It's not an ongoing problem.
So before you take the graft, can you tell which hair is going to be healthy and suitable? Or do you just take what you can and then decide?
Yeah, that's a good point. So it's really important to assess the scalp before you know whether a patient is suitable for a transplant, because not everybody will have strong enough donor hair. So it's important because patients may look at a website or someone's result, a celebrity who's had a result, and say, oh, I fancy that, thanks. But of course, it depends on their donor hair. You can't achieve something that's not consistent with the quality of your own donor hair. So firstly, we need to assess the donor hair just to work out what is achievable with that particular caliber of hair, the color of hair, the number of hairs there are per follicular unit. So there are lots of factors that will determine how dense a hair transplant will look in that particular individual. But you also need to assess the scalp to check that there is not a condition that's going to be detrimental to the outcome. So some people will have a thinning process which does affect the back and sides of the head, and it's not permanent hair, in which case that needs to be detected at the point of consultation, so that that person doesn't go on to have a transplant and then end up with a disappointing result. So when asking, does a doctor use a microscope as part of the process, it's also, I think, really important to check that you've been examined with a trichoscope, which is just a high magnification camera, which then we examine the scalp on the screen with the patient. They can see exactly what's going on in really close detail, and we can see how coarse the hairs are, how many hairs there are per follicular unit, the density, how many hairs there are per square centimetre on the scalp, and the condition of the scalp generally. So that degree of examination is important to check that those hairs are going to be healthy enough to withstand a hair transplant.
Interesting. So is there an optimal rate of hair loss that you look at before deciding to go ahead with a transplant, or not really?
So ideally, the hair loss should be stable. So you don't want to be operating on somebody if they're in an acute hair loss phase. You also don't really want to be operating on somebody who you don't know where their hair loss is likely to end up. So treating younger patients is very difficult because they've only possibly started their hair loss. I mean, it's especially difficult because they are distraught, as you can imagine. It's awful to be losing your hair, sometimes in your late teens and early 20s. But unfortunately, those, and particularly with men, they are the most at risk for a disappointing outcome because they're so emotionally sort of affected by the hair loss, and it's such an important formative time in their lives. They want the hair that they feel they should have, and they're comparing themselves to friends with great hair and celebrities, and what with social media, everyone's so aware of hairlines that it's really soul destroying for these younger guys. And the problem, as I say, is that they are the ones who have the potential, if they're losing hair at such a young age, the chances are they're going to go on to lose a lot of hair in later life. And you try and get a feel for where they're going to end up by asking about family history, assessing. There are certain factors you'll look at. So when these little temporal points here, when they recede back, that can be an indicator that somebody may have quite aggressive hair loss. Sometimes they lose hair behind and low down at the nape of the neck. Again, it's a retrograde alopecia where it creeps up from the back. These areas would make us think you're probably going to go on to lose a lot of hair. You know, they may come to me when they've only lost a little bit in the corners. And the worst thing you could do for them is to plant 2 bits of hair in the corners here. Then they go on to lose the rest of their hair. They haven't got enough hair in the back of the head to finish the job, and they're left with 2 little lines of hair or this little band of hair across the front. And sadly, they'll sometimes say, I get it that you're telling me that, you know, I shouldn't have this, you know, but I'm telling you I want it because it's now that I need my hair. Now's when I need to look at my best. And it's so difficult to be strong and say to them, I know you say that. And they'll say to me, look, I won't care how I look when I'm 30. They'll say, you know, I just need to look good now. And I'm saying, you really will care how you look when you're 30, 40, 50. When I do transplants in people in their 70s, you know, nobody ever stops caring about their hair. And you'll certainly care about your hair if it looks off. You know, it's not nice to be often ashamed of their hair when they're losing hair, but they're more ashamed of it if they've made a decision that's left them with a very unnatural looking hairline. You know, a bad hair transplant is way worse than thinning. So we have to be very, very careful with the younger patients to guide them to other treatments, and it's normally medical treatments, which are really effective, but it's not always what they want to hear, sadly.
So, speaking of the medical treatments, then what would you do for them?
So, if a patient isn't suitable for surgery, then I involve my trichologist. So I have a trichologist who is a medical hair specialist, or they're not medically trained. They are extensively trained in hair loss as a trichologist, and they're great at assessing hair loss. They're great at educating patients. They're great at talking about the non-surgical treatment options. And they can't prescribe, but they can direct, and a lot of the best treatments actually are available online anyway, through online mainstream pharmacies. So we try and we talk them through the main options. It's so easy to fall into the trap of buying some wonder treatment that you've heard about online and that some celebrity is promoting, or that they claim is the miracle cure for hair loss. And there's so much of that out there. And in reality, there's a very limited but effective group of treatment options that are evidence-based, safe, and are effective. So the first of which we try and encourage people to consider is the tablet Propecia. The generic tablet name is Finasteride. It's been around for many years, over 20 years. It's actually designed as a tablet initially for treating male prostate enlargement. So a lot of men end up on it in later life anyway, if they're getting up at night to go to the loo and they've got a week's urine stream. So it's a tablet that was discovered that at a lower dose, it actually helps to block the hormone conversion, which is what's attacking the hair and causing male pattern hair loss. So Propecia, or Finasteride, is a once-a-day tablet that can be got from a GP or from online pharmacies, that we encourage patients to take because it is by far and away the most effective way of stopping and very often reversing the hair loss, especially if you catch things early. All the treatments work best when you catch it early. The challenge with that particular tablet is that there's a lot of bad press about it. I don't know if it's something you've discussed in your clinic. You get people coming and asking about it. Is it something people talk about?
And my understanding is also that there have been some cases in the States of doctors who have actually been successfully sued for prescribing a finasteride. Something that I was discussing with Kish only the other week on a video. So,
So that is a worry, and there's this talk of the post-finasteride syndrome, which people will see if they search about it online. So I get a lot of people coming to me very concerned about taking it. They get that it works, but they just don't want the risks. And the main risk people worry about is loss of sex drive. There are other concerns: male breast enlargement, fuzzy-headedness, depression. So that doesn't really sell it. But the biggest concern is that there's a talk about, as you've evidently been discussing, the persisting side effects when it's stopped. And that is what people in the US have been sued for. It's a problem that we discuss endlessly at conferences. I'm really risk averse. I would not want to suggest a patient takes a tablet that could give them permanent side effects. I take it myself. I've been on it for years. I know that it's effective, and I've had thousands of patients on it with great success. I've had hundreds of patients on it who have had side effects, but I've had no patients who have had persisting side effects when it's been stopped. And we get a lot of feedback from these guys. So yes, it definitely can cause loss of sex drive, but it can stop within maybe a few weeks, maybe a few months. Some people have actually said it's taken 6 months to settle, but I've never had anyone persisting. And the general thought is that people who are saying they get these persistent side effects are falsely attributing their side effects to the pill, when it was actually just because they're older, or they've got diabetes, or they're stressed. So I think the pill gets a lot of flack for things that may not necessarily be down to the Propecia.
Can a patient, if they're taking testosterone in a cream format, still take Finasteride for hair?
Yes, so we get patients we get a lot of transgender patients, and they'll be on all sorts of hormonal treatments, and we liaise with their specialists to make sure that they're comfortable that we're not going to create a problem if they're on one thing. But very much so, it's something that we get a lot of patients who become very expert. So they'll often research these things. They'll get themselves on it without having seen a doctor. They'll sometimes step it up to the even more strong version, which is the dutasteride or Avodart, which is a double blockade treatment. So the Finasteride only blocks one of the receptors that causes hair loss. The dutasteride is a double blockade. It is therefore stronger, but it also has a higher side effect profile concern. It's not licensed for hair loss. So I don't suggest people take the dutasteride myself, because I think it's nice to stay within a licensed treatment. But it is another option. And then the other options that are out there that, again, been there for ages, the good old minoxidil, little regain foam. I mean, it's brilliant. It really works. And they add it to the tablets, and they're synergistic, and they see really, really impressive results. In fact, I'll show you. I've got a picture I want to show you. Often I need to show people some pictures for them to really believe how much these things can change. Can I show you a picture on?
Go ahead.
Let's do our clever screen sharing thing.
While you're doing that,
so
I was talking to somebody about the dutasteride, and apparently there's some clinical trials going on for using that in mesotherapy format in the hair, which I thought was kind of interesting.
So and the topical formulations are really encouraging. The topical Finasteride and topical dutasteride, and using it locally. I mean, it'd be lovely if we can find a way to reduce the systemic side effects, but some people find the topical preparations are unpleasant to use and still can get some systemic absorption. So although I've not prescribed it myself, but there are people who have shown some photos of some pretty impressive results. But as I mentioned earlier, it's very easy to show a photo and make a result look impressive. I like to see them with my own eyes. So have we got a screen share at the moment?
Yeah, I just did it. I think it worked. I'm hoping it did.
And have we got sound on YouTube, do you think?
Yes, we do.
Good.
We do.
All right. So this chap, I hope people can see it. This chap has been on Finasteride and PRP, which is another excellent treatment for adding in. So it's not very scientific when you start someone on two treatments at the same time, but some people are just desperate to get the best result they can. And you can always then withdraw one of the treatments down the line and see if you can sustain the result. But this guy was ready for a head shave. And he's managed to get significant improvement, even in the frontal area, where the main medication we talk about, the Finasteride and the minoxidil, aren't really intended and don't always improve this frontal area. But actually, when we added in PRP, we see quite nice improvements into the front as well. The crown, we always expect to improve well with the Finasteride and the minoxidil, but I think this is a pretty dramatic change, and that's just within a year. And I think for people to see results like that and to see how good their hair can be just with medication, I think is important, because they need to make these decisions based on fact. And I think if you just go online and you Google all these awful reports of Finasteride, you wouldn't go anywhere near it. But it's a shame to miss that opportunity, I think.
We just had a question about eyebrow transplants. I know that's something that you're not a fan of.
So it's not that I'm not a fan. I just think with all these things, we need to make sure that patients know the likely outcomes. And eyebrow transplants can be great, but even there are a couple of guys, there's a lady in the US, there's a chap in the US as well, who really specialize in eyebrow hair transplants. And they will admit that at least 5% of the hairs that are transplanted will grow in a slightly haywire direction. And it's not the end of the world. You can pluck them, trim them, you can train them with eyebrow wax, but the eyebrows will be quite bushy in comparison to the soft, natural flow of an eyebrow. And we spend a lot of time creating very flat incisions. So when I make the little pocket for the hair to go into, I place it really flat so the hair will flow nice and soft and close to the skin, and they taper out obviously really nicely. And the way that you direct the hair will create a really pleasing result, but there will be some lift, more than you would have had in a native hair eyebrow, and also some angle direction change. And my feeling is that I like people to consider an eyebrow transplant when they've tried everything else, and I think microblading is a nice option, and they should try the semi-permanent makeup options before they go down the route of a hair transplant. But certainly it's something worth considering. But if someone has very, very soft natural eyebrows, I think the result of a transplant can look too bushy and too coarse, in my opinion.
Because they're going to have to trim that, right, themselves?
Yeah, so because it retains the characteristics of where it came from, and we'll use the trichoscope so we can examine the hair very, very closely to select the hairs that are most close in hair caliber and characteristic to an eyebrow, but it is still scalp hair that you use for an eyebrow transplant, and therefore it will continue to grow. So yeah, the maintenance is quite a bit more than it would have been before.
Just on that same topic, actually, I've heard of people using body hair to transplant to the head. Is that a thing?
Yeah, so we do. I do a lot of beard transplant, both using the beard. We take it from the shadow under the jaw, and we take that by FUE, so it leaves lots of little white dot scars, which heal incredibly well. I'm always amazed how I can barely see where I've taken the hair from. And also it heals so quickly, within days, it looks incredible. So we can take hair from the beard and use that to supplement hair on the top on the scalp. Of course, beard hair has a very different characteristic to scalp hair. So it's generally coarser. It may be different color. It may grow with a wave or a curl. So you need to be really careful where you use it. So you will tend to put it somewhere centrally hidden within the bulk of scalp hair. And it's excellent when you get close to the end of your journey, because you've used up all the safe donor supply, and you're then having to resort to where else you can take it. So taking from the beard can be great. Putting into the beard is great too. So sometimes we'll use beard to beard if someone has patches. And obviously in the last 5-10 years or so, well, 5-10 years, it's been very fashionable for men to wear beards. And so beard transplants have been really popular. And people be very upset about something that may not come to your or my attention, but people are very specific about their beards, and they'll want a few hairs here and a few hairs there, and that's fine. It's a very safe thing to do. And sometimes we'll use scalp hair rather than beard hair into the beard, because they may not have enough beard in this area to use as a donor. And scalp hair can look good, but it will be finer and give a slightly softer result than the beard would have done.
Mm-hmm. I've read a question as well on YouTube. I think I'm going to know the answer to this one, but is it possible to transplant hair from another donor, or will it be rejected?
Well, I'm going to have a great answer on this in a few months' time, because because there's a couple of doctors. We have a very close community internationally, and we have a lot of meetings every year throughout the year. And a couple of the doctors that I know have transplanted hair from one to the other onto their forearms. It's a fairly sort of standard place people put hair when they're doing for a study. And they've treated it with light therapy and I forget exactly the concoction they've used, but obviously you need to try and dampen the body's immune response to it. So effectively, if you transplant hair from one to another, no, you can't, because the body will reject it. But we get patients all the time with their mother sitting next to them, or their spouse saying, and the spouse will say, take mine, I'd love to help. But, of course it doesn't help. We can't use it at the moment.
What about those the fibres that some people are using? I forget the name of them now. They're artificial.
Yeah, they're very good. So, there's the cosmetic concealer fibres, which you literally just sprinkle on. So they're very good. There's Nanogen, Topic, Derm Match isn't a fibre actually. Derm Match is excellent. It works differently. That's more like a concealer that you put on with a brush and it's a powder. But the fibres are great for people who have hair and they want to add the illusion of thickness, because the reason that hair looks thin is because of the contrast, which is why one person's result will look different to another. Because if you have very dark hair and fair skin, that color contrast is going to make that hair look thinner sooner in the hair loss process than someone with dark hair and dark skin. So often people will use the fibres. Some of it gets onto the skin and can be very good at removing that color contrast. Others will cling to the hairs themselves and make them look thicker. Some people get a bit carried away with them, and they can just cake it on, and their hair is like a thick crust of concealer. And I think they get to the point where that in itself is going to draw attention. So when used lightly, it can be great. The problem people have with it is that it can be a bit messy. They worry that if they were to if you go to bed with it in and they wake up and there's going to be brown dust on their pillow, they go out in the rain, if they're working out of the gym, it can drip. They worry about having drips of brown coming down. So obviously that would be alarming. So good options for that are, there's another product called Dermatch, which you actually have to physically shampoo out of your hair, so it doesn't come out in rain or sweat, but it goes on with a brush, as I say, and that goes a little onto the hair and more onto the scalp, and that can look very good. Or the next step beyond that is micropigmentation. I don't know if you've talked about that much on your live streams, but the scalp micropigmentation is a great way to add, if you like that look of taking away the contrast, then you can get a more permanent result by adding the little dot tattooing to the scalp. And when done well, that can look really good. As all things, when it's not done well, it can look pretty awful.
Is there not a fibre that people are actually injecting into the scalp?
Oh, yeah. Is that the one you meant?
Yeah.
That's not good.
No.
So no, sadly, as you can imagine, you're putting a foreign body in the scalp. It's then got this connection with the outside world. The foreign body reaction that the skin shows, and I've got photographs of poor patients who've come to me having had it done, and they can have scarring and awful skin deformity because of it. I love the idea of it because I love the idea of having a permanent, an infinite donor supply, and it's wonderful. But in reality, it's pretty difficult to get a good result with that, and the complication rate is pretty high. So it's something to be very wary of. And also, I think sometimes just having hair putting into a bald area isn't enough to get a good result. You know, there's so much in the artistic element of what's being done, understanding how to make a hairline look natural and how to make it, how to make it look as if it's always been there. And if it's done by someone who's not necessarily used to understanding how hair loss progresses and how to frame a face, I think it can end up looking very unnatural.
We just had a question about, does light therapy work?
Yeah. So laser, low-level laser or low-level light therapy is it's been around for years. I've got one sitting right beside me. It's my one I use. So they come as sitting loose on my head earlier. So it's not the most discreet, subtle version. This is the Theradome, which I rather like, but they've got these little diodes in the helmet. This one I quite like because it has a cooling mechanism and it talks to you and tells you how long it's been on for and which treatment you're on, and you feel a bit more engaged with it. The biggest problem with laser therapy is that people just don't use it. So people buy the really cheap ones, which is a handheld comb, and you've got to hold your arm up, and it's uncomfortable, and so it just nobody uses it, so it doesn't work. If you can get something that's easy to fit into daily life, and that's quite nice because it's not too expensive. There's others I used to use which are 3 times the price, and a little bit more powerful, but it's hard to justify the expense in something that unfortunately you can't give a guarantee as to how effective it's going to be. So for women, often they do exceptionally well with laser. It does really well when you combine it with other therapies. So if you add it into minoxidil or Propecia or PRP, I think they get a synergistic effect and they can be really effective. A lot of the products, including this one, actually are rather nice because they do give a clinical guarantee. And if you don't see a benefit within a certain number of treatments or a year, then they'll offer you a high proportion of your money back. Often it's 75-80% of the money back. So that suggests some confidence from the manufacturers. So I rather like that.
That's good. And how much is that device? Like just roughly?
That particular one is just under 800. It's
okay.
795. That's the Theradome. And the one I used to recommend was the laser cap, which I still recommend. It's great. It's been probably the market leader for years, but it's best part of £2,000. But again, they both offer this clinical guarantee, which I think is great. I've never yet had anyone return a Therodome to me, which is pretty encouraging. So I like them. They're great for people who don't like the idea of taking something pharmaceutical. So a lot of people don't want to take the tablet. They don't even want to use the Regain foam or liquid because they don't like the feeling of it on their hair. I think that's very difficult for women. So having something that's not pharmaceutical and it's very, very safe and easily done, and you just wear it for normally it's between 15 and 25 minutes a day, depending on the device. That's rather nice. And then, if people who really don't want to do anything pharmaceutical will often love the idea of PRP, the platelet-rich plasma treatments, because, of course, it's their own body re-injected into their body. So that gives a certain element of reassurance.
I did have a question about that. When you do your PRP, do you use a topical anaesthetic, no anaesthetic? You're doing a block? How are you doing it?
Yeah. So I spent ages looking at this because it's... have you had PRP?
Not on the scalp, no.
No. So... I've had it a few times, and I don't mind it now that I've found a way to do it nicely, but it can be really uncomfortable. And I've had people coming to me saying it was agony where they've been somewhere else, and they'll just inject it. And you can inject it using a syringe, which is very quick, and they don't use anaesthetic maybe. But to me, it's something that you need to have done fairly frequently. And recent papers published at the end of last year have suggested that 3 to 4 monthly is probably optimal for scalp PRP treatments now. We were trying to get away with 6 to 12 monthly to try and spread it out for people, but I think people are going to get better results, even better, if they do it maybe 3 to 4 monthly. So if you're going to do that and it's going to be painful, that's pretty unpleasant. So I used to just do a ring block and local anaesthetic, which in itself, of course, is really painful. So that's unpleasant too. So I now use a mesotherapy gun, which I think is brilliant. It means the process, instead of taking 10 minutes, can take an hour to an hour and a half. So it's a long process, but it's so much nicer for the patients. So no anaesthetic needed. You just feel little prickles or taps. Some bits can be a bit sensitive, but every patient without fail, if there's been a day where my nurse hasn't, because my nurse does the PRP treatments, if there's been a day where she hasn't been able to do it for whatever reason, I've offered myself doing it with the local anaesthetic, and without fail, every patient said, I'll take a break on that, and I'll just come back in a week or two. Because nobody wants my anaesthetic when they've got this other option.
And what meso gun are you using?
I use the U225, It's the French one. It's been around for ages. I'd like to say it's bulletproof, but it's been back to the suppliers to be fixed like 3 times already in a year. So it's a really good device, but I think we have to have 2 so that we've got one in store for in case it decides not to behave.
I used to have one. I sold it actually. Can I just ask about the caffeine shampoos? Someone's asked on YouTube. Do they work?
No. So there's so much potential for selling stuff that sound good and that people want to hear, and there's so many really successful shampoos out there that people buy that really have very little hope of helping with hair loss. And they often, if you read the labels, they don't say they're going to stop hair loss. They say they're going to be good for hair health and scalp health and make your hair maybe look a bit thicker, which is fine in itself, as long as it's not causing any damage to your hair. That's fine. But caffeine in itself has been shown to help hair loss, but in the concentrations that you're actually getting into the scalp from a shampoo, it's in contact with the skin for such a short period of time. The only real ingredient that I believe helps with hair loss in a shampoo is the nizoral ketoconazole ingredient, which has been shown to be a DHT or have some DHT blocking properties. So people will use nizoral or nizoral as an anti-dandruff shampoo, and that definitely has some decent evidence to suggest it can be helpful for male pattern hair loss. It's tiny, obviously, but all these things can add up. So once you've treated with the most important things, and ideally the Propecia, PRP, minoxidil, we then we look at supplements, and laser probably sits above supplements, and then we've got the shampoos, which I think is important just for health. So there's a shampoo I rather like because it's got the ketoconazole in it. The nizoral they come in these tiny little bottles. It's really harsh on your hair and leaves it all squeaky. So it's not a very nice thing to use. The same ingredient is in another product called Regenipure, which is lovely. It's got caffeine, it's got tea tree, it's got biotin. It's pretty much everything you've ever heard or read about with hair has been thrown in it. It may work. I don't know, how much of it actually absorbs, but the fact that it's got ketoconazole and it's free of parabens and sulfates, which people like, and I think it's nice and gentle on your hair, and it comes with a nice volumizing conditioner. So that's good, I think, for people who are looking at trying to block that DHT, which is what's causing the hair loss in so many people. But there are other specific shampoos that are good. If you've got actual scalp medical pathology, then there are shampoos, of course, that would be very helpful, and that in turn may have a benefit for the hair loss. But to actually treat androgenic alopecia with a shampoo is pretty optimistic.
Is that something that women can use as well, or is it just men? Yeah.
So the Regenipure that I like, that as I say has all sorts of goodies in it. There are two types. One that has the ketoconazole, and another doesn't. And I suggest the non-ketoconazole for women. As I said, and I really like it's got a lovely biotin conditioner, volumizing conditioner, which I think people would get on really well with. So that's great for women or men. If anyone's got, often we'll when we see patients in clinic, we'll do the trichoscope, we'll look at their scalp, and we'll often see that there's quite a lot of debris around the hair follicle, whether it's sebum or dry skin. And I think if you're using a topical treatment or laser, or I guess pretty much any hair loss treatment, if the follicle is blocked and the scalp isn't in great shape, it's not going to be as able to respond well to the treatment. So if we can cleanse the scalps, and that's where the trichologist comes in. So Eva, my trichologist, is great at just preparing the scalp for any future treatments, and it'll respond better. So it's worth seeing somebody often, I think, rather than just plucking something off the shelf. It's worth getting a proper assessment so that then you can target your treatment properly.
How does she prepare the scalp?
They do. So I let Eva do her thing. They're so specialist and they're great at what they do. A lot of what the trichologists do is about scalp treatments, and I wouldn't even start to go down there and tell you what they do. But I think my concern with a lot of these treatments is that they need to be something that fits in with people's lives. So like in the old days when lasers were done in a clinic, and you'd come in and sit under this huge hood like those old hair dryers, and that's just not practical, because nobody's going to want to come into a clinic and have that done as often as it should be done. And the same with scalp treatments. So there's no point in having something that's so complicated it has to be done by a trichologist and no one else. So I think things that you can do at home with shampoos are realistically going to work better because you will comply with them.
In terms of supplements, we met, for everybody at home, at a Viviscal dinner years ago. Is that something that you're still recommending, or are you using something else?
Yeah, I like Viviscal. I think it's great. I think it does fall quite low down in the hierarchy of treatment options because people have to be realistic about what you can actually achieve from a supplement. But it has got some pretty good evidence behind it. It's safe. It's very well tolerated, provided you're not shellfish allergic. I've had patients who love it. I think if I give a patient, I learn so much from my patients, because if I've had a patient who I've treated and they've seen a result from a hair transplant and they love it, and then I'll follow them up, and then I see them, and when they've maybe off their own bat they've started something like Viviscal, and they come to me and they report significant changes with it, then I really trust that way more than I will a bit of advertising on a packet. And I've had patients who've taken it, and one good way to test something, of course, is to take it and see the benefit, then stop it and see what happens. And when they've done that, and they said there's been a significant thinning when they stopped it, and I've had this report from a chap only a week or two ago with Viviscal. So I think it definitely can help. It's quite a lot to invest in a supplement. I mean, it's best part of £60 a month, which I think is quite a lot for a supplement. But if you don't fancy the other options, I would have everyone on it, if money no object. But I think it's definitely got a place. There's another supplement I rather like called Help Hair Protein Shakes. Have you come across them at all? So it's an American brand. Protein shakes have been shown to be androgenic, so they stimulate testosterone, and that in turn can raise your levels of DHT, the hormone that's causing the bulk of male pattern hair loss specifically. So protein shakes there's a lot of association between them and thinning hair. A lot of patients or colleagues, when I've chatted, have said they've had patients who they haven't quite understood why they've had this sudden dip in their hair density, and no clear reason for why. And then eventually they'll they'll get down to the details, and it'll coincide with when they've been working out loads in the gym and they started piling on these massive protein shakes. So whey protein isolate is thought to have an association with worsening hair loss. This particular protein shake is not an isolate, and it's processed in a different way, and it has other aspects, which, I mean, it's got biotin and all the standard goodies that you get in a normal hair supplement, but the way the protein is metabolized is intended to actually help with hair loss. I actually use it mainly in patients who I've had to give a silly haircut to. So occasionally, the reason not to say sorry, but because it makes, one of the side effects is it grows your hair quicker. So
okay.
People say that, I don't know if you found this on. Did you ever try Viviscal?
I did, yeah.
Did you like it?
I liked it, but I'm using something else at the moment called Biosil, which
okay.
I don't know, I might prefer.
Okay, cool. So did you notice that your hair and nails grew quicker?
Nails.
With either?
The nails, not the hair.
Right.
Yeah.
Okay. So one of the side effects tends to be that hair grows quicker. So if I've had to shave someone's hair to do a transplant, either the sides or if I'm operating within existing hair, then I need to shave that normally. And everything we do is about trying to create a really discreet experience for people, and I want to make it as easy as possible. And so we try not to cut hair if we don't have to. But if I think it's going to be seriously detrimental to the outcome, then patients are often willing to allow me to do it. And we may just shave into an area and they grow the hair a little bit to cover it. But either way, they're keen for the hair to grow back as soon as possible. So we will often use this Help Hair Protein Shake in the couple of months pre-op to sort of prep them, and then for a few months afterwards just to encourage their hair to grow quicker. So I think it's useful for that. But some people, again, are passionate about how it's benefited them with their hair thinning as well, and that's great. But I don't push it a huge amount because, again, it's not inexpensive, and I think it's better to put your money into something that has really good evidence, like the tablet, the foam, and PRP, etc.
Well, actually, talking about the tablet, somebody's asked on Instagram, is taking 1 milligram of Finasteride 3 times a week enough for preventing hair loss?
Yeah, so I like the idea of the dose being quite constant. So lots of people do that, and I have lots of patients who do really well with it. I think there has been a lot of evidence to show that lower doses still are very, very, very beneficial. And you can get some people just quarter the tablet and take a quarter of a tablet a day. That's fine. And then maybe they build up a little bit of confidence in it and will increase the dose. But yeah, I think it's fine to try the lower doses. But as I say, I think if you can find something you take every day, I think your compliance with the tablet is going to be better, and you know where you are. And I suspect, therefore, your blood levels will be more constant, which I think is going to be beneficial.
Someone else said that in their understanding, there were no studies proving that PRP therapy for hair loss actually works, and they're wondering if that's correct.
So there's this paper I referred to. So it was in the Derm Surgery Journal in October. It was a meta-analysis that brought together lots of different publications and really broke them down. And there's definitely evidence to show it works. However, when reading a paper, as you know, you've got one paper will be exceptionally well written and a study that's very robust, and others will show a result that shows a success, but it's such a poor study you can't give it any credit. So unfortunately, a lot of the studies that have looked at PRP have been poorly conducted studies. So although there is a lot of evidence out there published to say PRP does work, you can be quite brutal and critical of the way those studies were conducted. So there's still more work that needs to be done to convince us all. It definitely can work, which is why I do it. I mean, we're so open with patients. They know that they're going to be somewhere in the spectrum of results. Some people, it may just slow their hair loss. Others will actually see thickening. I've got actually. Can we do a quick screenshot thing? Screen share. Sorry.
Which system are you using?
Where are we? For PRP?
Yeah.
So I use the Solenis device. I've been through a few before we used the Angel device, which is lovely, and scientifically it's so robust, but it's very expensive. It produces very small amounts of PRP. It's very hard to justify the cost to the patient because of the consumables are so expensive. And actually, we're getting fantastic results with Solenis, which, for various reasons, I think is easier to use it within the clinic, and it's an easier patient experience. It requires a lot less blood from the patient as well. So yeah, so it's a nice bit of kit. It's nice. It's a gel separation tube rather than some of the other more simple ones.
Yeah, I have the Angel as well. It's quite faff, isn't it? It's very expensive as well.
You've got the Angel? Yeah. Did you say it's quite fast?
Quite faff. It's quite difficult.
A faff, exactly. Yeah, so it's not difficult. Right. It's great. The science behind it's great, but it's not a. It's not. Sorry, are we on a screen share?
As soon as you get your pictures.
Okay, cool. So this is important because I think I always like to show quite detail. I mean, as I said earlier, it's so important that people don't just show a shot, one angle with a bit of shadow can make anyone look like they've had a treatment success. So this is a guy that had already been established on medication, and we on finasteride for 5 years or so, and we then added PRP. And what I love about the PRP is it's showing some improvement in this frontal area that all our other medical treatments are not really that great at. Now, it's difficult because you could say, oh, his hair's a bit longer. I don't know, actually. I think the hair's probably very similar length. But he's definitely got improvement here in this frontal area where it was before. I mean, look how see-through that was. And now he's got real benefit into the front. So there's definite volume improvement. There's nothing else that's changed in this guy. The photos, actually, there's another one that's quite nice for the photos as well. Here we go. So it's not groundbreaking. The changes aren't groundbreaking, but where someone's got literally see-through scalp, get significant improvement with PRP. But not everyone is going to see that. I think here you can see same mold, quite wispy hairs. When I look at these, I just think, well, which one would I rather be? Well, definitely the right is a better density of hair than the left. But there's too many questions we don't yet know about PRP to be able to give concrete sort of assurances. And it does seem that the sample that you get from PRP is very variable, even within the same patient, using all the same kit. And I think that's one reason why you'll sometimes see a patient get a different result from one treatment to another than maybe 6 months later. And people have to know that, but there are factors that we can't control that will give you different. I think the level of inflammatory mediators within the PRP will vary, and that has a bearing on its result too. So it's not black and white.